Two questions that are really reflective of if you have a good relationship are, do I understand and respect my doctor? And does my doctor understand and respect me? If you can say yes to both of those questions, that means that you have a good doctor-patient relationship. Primary care physicians will give you the longitudinal perspective. They follow you through your care. Prevention is a very big part of primary care, keeping you healthy. What are we doing to make sure that you don't end up developing a cancer that we could have prevented or a heart attack that we could have prevented? We also get to know you, get to know all of your conditions so that you can really pull somebody's health together.
I think one of the things that patients can do to help prepare is write down their questions. Rushed in, you get a blood pressure check, and it's very easy to forget the list of things that you might have concerns about. Bringing your medications in, that's super helpful. One doctor somewhere else stops a med, you go to the hospital or urgent care, they start a med, and then I start a med, and unless I know exactly what you're taking, it becomes very, very difficult to manage.
Make sure that you bring any old information, such as immunization records, colonoscopies, old pap smears. That's very important. The tests that are ordered during an annual physical really depend on you as an individual patient.
If you're a younger woman, you're gonna wanna do your cervical cancer screenings, breast cancer screenings, colon cancer screenings. If you're a smoker, lung cancer screening, diabetes, cholesterol, those things are very important as well.
It is not one size fits all. So a good place to start is the United States Preventive Service Task Force. But really, there's no substitute for sitting down and having a one-on-one evaluation with your physician.
Other thing that we've started screening for that's very, very important is something called the social determinants of health. Basically what drives a person's healthcare, whether they can afford their medicines, whether they can afford their housing.
Do they take your insurance? Are you able to get in for an appointment? If you have a good trusting relationship, you're more likely to work well together as a team if you trust each other to provide good, reliable information.
If you don't have that trust as that foundation, the whole thing just falls apart.
He knows everything about me. Like he knew I had been in the hospital. He knew I had talked to Dr. Love yesterday. When my husband went for his visit after the hospital, I went with him and I went in the room with him. And when I met Dr. Avind, I liked him immediately, and that's why I wanted him. We share some family stories, laugh, then we get down to business. He's honest, he tells it like it is. When I go there, I feel like I'm visiting family. And that's a nice thing.
You should look at yourself as a consumer. You should shop. People spend more time looking for the car mechanic than they do their doctor. Find the person that resonates with you, that fits your style and really speaks to you.